Hi and welcome. My name is Sheila Kilbane. I'm an integrative pediatrician here in Charlotte, North Carolina. And I'm talking to you today because I recently did an Ask the Doc conference call. And I do these once a month. It's a free once a month call where parents can call in from anywhere and I answer their questions. And we focused this past month on recurrent ear infections and how to stop the cycle. And we got such an overwhelming response and people with questions and interests in how to help kids with recurrent ear infections that I wanted to make a video to give you just a little bit more information. So I am an integrative pediatrician, and that means that after I did my general pediatric training, I went on and studied for 2 more years about nutrition and herbs and supplements and mind-body therapies with Andrew Weil, and he's that guy with the big white beard who has written lots of books on herbs and supplements. And what I found is that once I started incorporating these natural and nutritional therapies into my daily medical practice, a lot of these chronic pediatric illnesses were melting away. And the reason I went into that to begin with is that as a resident, as a kid, I always knew I wanted to be a physician. I was cutting open frogs, and I was the one, if anybody had a sliver at home, I was the one taking the slivers out. So there wasn't a doubt in my mind that that's what I wanted to do. And when I finished residency and started my first job out of residency, I was driving home from work one day and I just went, is this it? This is what I've studied all of these years to be doing? I felt like I was on a treadmill. I felt like I was running from room to room, seeing a patient every 15 to 30 minutes. I was seeing a lot of the same patients every month. These were kids with recurrent ear infections, eczema, asthma, colic, reflux, and I was giving them steroids, I was giving them antibiotics, I was giving them antihistamine or allergy medications, and I didn't feel like I was helping them. And there was something in me saying, there's got to be more. There's got to be something else we can do for these kids. So a couple of years after that, joining that first practice, I really started reading a whole lot more about allergies and understanding that nutrition could play a huge role. So, a few years later was when I did the Integrative Medicine Fellowship, and then my satisfaction in medicine went through the roof. I was so much happier practicing because I could really make a difference with these kids. As I had the tools I needed to get to the root of their illnesses or their issues. And so then, as I really started incorporating this nutrition into practice, it just changed everything. And so 2 years ago, I completely left my traditional practice and I started my own practice, and it's called Infinite Health. And what I do now is I spend an hour and a half at the first visit with these families so that we can really comb through everything, and then I give them just a plan so that we can get their issues worked out. And through all of this, like I had said, I really understood that we could have a huge impact on stopping that cycle of recurrent ear infections. And so the 2 questions that I learned to ask myself from integrative medicine about these infections were, number 1, why is the body requiring stronger and stronger antibiotics to get rid of these infections? And number 2, what's going on with the immune system that our body isn't taking care of it? We know from research that about upwards of 65% of ear infections will go away on their own if we can help control the child's pain. And it's hard to know, though, when a child is in pain, which one of those are going to go away and which aren't going to go away. So that's the reason, and we want to be careful. We always want to, if a child has a true blue, properly diagnosed ear infection, it is really important to have those treated because you can go on to have complications if they're not. What I'm talking about is when we have a child and they have a host of other symptoms that we can see there's inflammation in their system. And so the 3 main things that I look at in stopping their cycle of recurrent ear infections, 1 is, do they have some inflammation from food? Do they have a food sensitivity? Are they eating the typical American diet where they're having a lot of processed foods, a lot of refined sugars? That inflames the system. And what that does is our eustachian tube is the part of the ear that drains from the middle ear to the back of the nose. And if that eustachian tube is inflamed for whatever reason, the middle ear, the fluid isn't going to be able to drain to the back of the nose or to the back of the throat. The second area that I look at are allergies. And those, we're talking about environmental allergies. And those can be outdoor allergies or indoor allergies. And we have wonderful lab work that we can do for testing with those kind of allergies to decipher if the kids are having issues or not. And then the third thing we look at is anatomy. Is there anything going on that is preventing that eustachian tube from draining? Is there anything in the child's anatomy that may be preventing that? And so we discuss different ways of looking at the anatomy and helping that to make sure that that eustachian tube is drained. So I just wanted to give you that a couple more tips on recurrent ear infections and invite you to check out my website at SheilaKilbane.com. And I also encourage you to sign up for my newsletter, and that will keep you updated on when classes are. We have some great upcoming classes, including one on how to stop the cycle of recurrent ear infections, and it's called All About Ears. The registration isn't open yet, but we will, early next week, we'll be sending out a link to sign up for that, okay? And if you know people whose children suffer from recurrent ear infections and you think they might be helped by this information, please forward this on to them. And if you haven't already, come on over to my Facebook page. It's SheilaKilbane.com, and just like it so that we can help spread the word about integrative medicine. And Happy New Year to all of you, and have a great afternoon. Thanks so much. And if you are in Charlotte and you do want to come and see me as an individual patient, the telephone number is 704-708-4404. Thanks so much.